Thank you so much, Dr. Allison, and we're glad to have you back again. And I know we were in New Jersey together as well, and you are friends of NANNA. And I want to join also my colleagues to also thank our keynote speaker, for doing justice to our topic, global health priorities, sustainable health care during and after pandemic. I think we should all go home now because she has done the job already. So I just want to thank you. Right. So thank you so much, Dr. Mentari, for doing that. So for the future of nursing, 2020 to 2030, I just want to bring us back. So the outline what I will discuss in the next 20 minutes is to review 2010 to 2020, the key messages. Remember we started, like Dr. Sandra said, the future of nursing, leading change, advancing health. That report came out in 2010. And during that time, I will talk about what NANNA did. So the key messages in that. And I will also now discuss what Dr. Allison said, the key messages of the future of nursing 2020, charting a path to achieve health equity. And that is why I said I want to thank our keynote speaker who had actually done a great work laying the foundation. We have all the statistics, about the problems, the health disparities we're having. So we will look at charting the path forward, especially with NANNA, what our plan is and how we try to implement our strategies within this report that has been provided. By looking at the social determinants of health, and then we will discuss the intersectionality. I'm not going to repeat what the keynote speaker has done. She has done a great job, but I will focus more on the role of nurses, especially NANNA nurses, in improving the health of individuals, families, and communities, and how we are addressing the social determinants of health and what we can do further to expand on what we are doing right now. And then we will now look at the conclusion. So in the first area I'm going to discuss is the reviewing that key messages from 2011. We all remember when we gathered in Los Angeles, for those of you who were with us in 2011, when we met, we reviewed the key messages from 2011 report. And at that time, those 4 key messages that we focused on were nurses should practice to the full extent of their education and training, which was 1. Nurses should achieve higher levels of education and training through an improved education system that promotes seamless academic progression. I'm sure many of NANNA members remember this. And also that nurses should be full partners with physicians and other health professionals. We need to know where we are coming from so we know where we are going. And the effective workforce planning and policy making require better data collections. So these were the key messages in 2011. So when NANNA met, because that was the future of nursing 2020 at that time. So when NANNA met in 2011, we look at these key messages and we said what was important in that. Number 2 was that nurses should achieve higher levels of education, and train through an improved education system that promotes seamless academic progression, and that nurses should be in full partners. So we realized that for us as NANNA members to be in full partners with our colleagues, we really need to prepare at higher level of education. And so NANNA actually met the board of directors and came up with intervention, which tomorrow, don't miss that session, the research committee will actually provide their findings from 2011 to 2020, where we are with NANNA, the intervention. And in that meeting in 2011, that conference, we only have 2 NANNA members that were that had a PhD, in nursing at that time. 2, 2011. Fast forward now, because we focus on nurses to achieve higher level of education if they're going to be partners. So we put a lot of effort and intervention in place, within NANNA. And today I'm glad to report that we have over 100 NANNA members that are JMP, that have JMP and PhD in nursing. So why do I have to go back to that history? Is because if you look at the report for 2020 to 2030, we say charting a path to achieve health equity. And if you look at what the keynote speaker had said, the data she has provided about where we are when it comes to minorities, and see the impact of pandemic on minorities, you can see that now NANNA is prepared because we have NANNA members who now have the education. But guess what? You now have to use the education to effect the change in the community. So if you're looking at the key messages for 2020 to 2030. So what are those key messages from 2020 to 2030? What is it that we should be doing? So in NANNA, we're also saying we need to look at these key messages so we can key in and so we can be effective in our community. If you look at number one key message in this report that has just been released, is that policymakers need to permanently lift artificial regulatory and practice barriers that keep nurses from practicing to the top of their education and training. If you remember, like I said, in 2011 report, the 2020 IOM report says that nurses should practice at their level. But now we are saying, now you have the training. Are you allowed to practice? So now we are saying, key message number one, take away. Policymakers need to permanently lift artificial regulation. So if that is a keynote, what can we do as NANNA members to make sure that these artificial regulatory practice barriers are removed? Because we've seen the statistics provided to us by the keynote speakers, how our people are being impacted, how we see the poor outcome, health outcome within our people. So this is a very important keynote. So in the next 10 years, we've had this part that we have to follow, how we can work with policymakers. Number two, public and private payers need to establish sustainable and flexible payment modules. And number three, nursing schools need to strengthen education curricula and expand environments where nurses train better, like what the keynote speaker said, to focus on social determinants of health. And number four, that employer must support nurse well-being so they can in turn support well-being of others. And number five, nurses need to leverage their own power to advance health equity. And the keynote speaker also expanded on that by making sure they are well prepared to bridge medical and social needs. So I am glad to say that NANNA members are well trained now, but are we prepared to bridge medical and social needs, taking care of our own health so that we can now care for others? And most especially, like the keynote speaker said, advocate for policies and that address poverty, racism, and other conditions that stand in the way of health and well-being. This is very, very critical, advocating for policies. But I'm going to say what? Instead of us advocating for policies, why not become the policy makers? So the takeaway from this conference today for NANNA members, as you are sitting here, you are prepared already. It took us 10 years for NANNA members to be prepared, from 2 PhD or PhD holders to over 100. So we have enough people, not just to advocate for policies, but to be the policy makers. That is going to be between 2020 and 2030. How many policy makers are we going to get from NANNA members? The keynote speaker has actually done a great job by talking about social determinants of health. And according to Florence Nightingale, and I always quote this, health is not only to be well, but to use well every power that we have. So as nurses, we are powerful. And as Nigerian nurses, when it comes to minority health, we should be at the forefront to achieve that. Look at what the social determinants of health, like the keynote speaker said, the complex, integrated, and overlapping social structures and economic systems that are responsible for most health inequities, conditions in which people are born, grow, live, work, and age, social determinants of health. So as NANNA members, we have our work cut out for us. We have the credentials behind us now. How can we use our training to address these conditions that are now barriers to good health? These social structures and economic systems include the social environment, physical environment, health services, and structural and societal factors. And I'm going to join the keynote speaker also to say that. And the World Health Organization said that social determinants of health are shaped by the distribution of money. Hello, we all saw what happened during the pandemic. Social determinants of health shaped by distribution of money. Even during the pandemic, I'm from New York too. Well, resources were being denied to New York, okay, by the president. Social determinants of health are shaped by the distribution of money, power, resources through our local communities, nations, and the world. As NANNA members, what do we know about that? How do we know about the resources that is coming to our communities? How do we ensure that our communities are using resources to their disposal and they're using it appropriately? Very important for us to pay attention to that. You know, and the keynote speaker has addressed these 5 elements of social determinants of health. Where you work, where you live, you know, are all affects health. Very important, intersectionality of health. Health in everything we do, there is health. So without health, we can't really move forward. So how are we prepared to ensure that these intersections of social determinants of health is being addressed by our organization? That is the focus of this conference this year, to look at that 2020 to 2030 report and see how NANNA could integrate or take that report and look at our programs and how we are going to effect change. What is health inequity? For example, social conditions in which people live, like we talked about, and interact, powerfully influence their chances of being healthy. So if we are helping our community, like our vision says, we need to take this report very seriously and make sure that injustice is being addressed, you know, by us. According to the Institute for Diversity and Health Equity's 2015 benchmark study, minorities comprise only 40% of hospital board members. Minority only comprise. But I was so glad that our keynote speaker, she sits at the policy level, you know, when it comes to New York. And also, I think I saw Dr. Williams, you know, from Yale online also. These are powerful nurses, minority nurses, that we want to also make sure that Nigerian nurses are in the policy, sitting at the policy level. Because look at right now, the study says only 40% of hospital board members are minorities. 11% of executive leadership positions, only 11% are minorities, and 19% of first and middle level managers. So if we are not at the table, we will be in the menu. So if we are not sitting at the policy level to make changes, you know, to have our voice be heard, guess what? We will not be able to focus on inequity. You know, so African Americans account for only 9.9% of nursing workforce in the US. Furthermore, only less than 6% of African American nurses are in executive leadership position. So how can we effect a change? How do we path forward to make sure we advance equity if we are not sitting at the table? You know, and this is what it's about. We cannot address social determinants of health if we are not part of the policy makers. So this is a call to action for us that nurses, you know, is a challenge. Like what the keynote speaker said, at whatever level you are practicing, you have to ensure that you are influencing policy. Without influencing policy, we will not be able to achieve or address social determinants of health. What is the challenge before us? It says that, according to the Commission on Social Determinants of Health, a toxic combination of poor social policies and programs, unfair economic arrangement, and bad politics is responsible for the fact that a majority of people in the world do not enjoy the good health that is biologically possible. My goodness, toxic combination of poor social policies. So we now have to rise up to make sure that those poor social policies are changed. We must rise up because now we have the training behind us. What is our role in addressing health equity? Nurses must advocate for health funding policies that promote equity, efficiency, and effectiveness, and ensure that the rights of most vulnerable are not forgotten. That is what we must do to address social determinants of health, to address inequity in healthcare. We must not only advocate, we must be part of the policy makers. That is so important. 2011, we talk about having the education behind us. Now we have education, but now we must do what? Use that education to effect policy. Remember, what is the passion behind it? Passion for social justice. Nursing is not just about providing care. We always said what? Oh, I'm just a nurse. My dear, you're not just a nurse. You know, and according to Martin Luther King, he said, I have a dream. I have a dream that by 2030, which is the what? This report, by 2030, Nigerian nurses will be part of policy makers. The driving force, nursing is not just about providing care. Nursing is about the general commitment to the values of mankind. Not according to even the keynote speaker, is the commitment to the value of freedom, equality, solidarity, tolerance, and respect of nature. You know, nursing is not just about providing clinical care, but it's also commitment to social, economic, spiritual, and environmental considerations. We saw how resources were problems during pandemic. So if you are not at the table, you'll be in the menu. Nurses, we have direct experience and a thorough knowledge of healthcare needs of our people. And I'm so glad that every chapter members, we have almost close to 21 chapters. We have health missions. Our members go to the community, you know, to focus on health. Now we are saying it's not just enough going there to do blood pressure and education, but now we have to be at the table. Are you in the board? What board do you belong to? Leadership. To play an active role in addressing health equity, the nursing profession must produce leaders throughout the system, from the bedside to the boardroom. Very important for us to chart a path to achieve health equity by 2030. We must produce leaders. And in this forum right now, I know we have leaders. Nigerian nurses are leaders. But guess what? You must use your leadership to effect a change so we can achieve health equity. The leadership of Black female nurses is needed, and not only female Black nurses, but also male nurses, to ensure delivery of culturally competent care for the expanding diverse patient population, as well as to provide role models for Black nurses aspiring to be in leadership position. So as you are in this forum right now, what board do you belong to? You heard our keynote speaker. She belongs to a lot of boards because she wants to influence policy. What about you? We have to really do that. We get to move forward. We have to move away from the comfort of our zone, comfort zone. Last weekend, NAUSA members, which is Nigerian nurses in New York, attended the New York ANA New York conference. I look at the room and I ask the question, where are Nigerian nurses? It was only the few 7 or 8 Nigerian nurses from NAUSA that were in that conference. So where are Nigerian nurses? So where are you? What are you doing? You need to move from the comfort zone. We need to be at the policy aim to be able to effect a change. We can't do it just being at the bedside. Practice. Nurses should practice to the full extent of their education and training. Look at your title. Look at your name, the title behind your name. Oh, Dr. Johnson, Dr. this. What are you doing with that PhD? What are you doing with the DMP? You know, what are you doing in the community to effect a change? Nurses should practice to the full extent of their education. Deal with health issues as well as equity and social determinants. How are you addressing that? We must identify barriers to care and to provide strategies to overcome the barriers. We have a lot of nurse practitioners, but there are barriers for them to practice to the full extent of their education. So we must participate in policies to remove those barriers, raise public awareness, and provide training on the social determinants of health to policymakers. While we are training policymakers, we must also become policymakers ourselves. We must provide information to stakeholders and practitioners to make sure that these social determinants of health is being addressed. Develop professional and technical tools to support practice that focus on reducing health disparities in our community. Yes, we provide health information to our people, but guess what? Nurses must be involved in policy. 2020 to 2030 report says what? Charting a path to achieve health equity. You cannot achieve health equity if you are not part of the policy makers, if you are not part of politics. And I just want to give a shout out to New York nurses, by supporting our current new mayor that was elected last week Tuesday. And so the nurses were involved in New York. They really supported this mayor, and that is what we're saying. And I'm not going to vote for our keynote speaker to become the next mayor. We want our keynote speaker not only to be in the HHC, but we want her to be at the end of politics. So nurses should not be afraid to be part of policy, because politicians are the one who makes what? All these decisions. So if you are not part of the policy makers, you will be in the menu. Very important as we talk about policies, recommendation for nursing organizations. 2020 to 2030 report is saying that national nursing organizations should initiate work to develop a shared agenda for addressing social determinants of health and achieving health equity. So we have to have a shared agenda. And my recommendation for the shared agenda is getting nurses involved in politics, getting nurses involved in policy. This agenda should include explicit priorities across nursing practice, education. The keynote speaker has spoken about that. Our curriculum must address social determinants of health. Our curriculum must address policies. Our curriculum must address politics, calling nurses to be in politics as well. Leadership and health policy engagement, very critical. Diversify the healthcare workforce for an opportunity to destroy the systemic biases and racial inequities that persist in healthcare. Very critical that our workforce should reflect the population we serve. So if you look at the healthcare leaders in New York, how many of them are minorities? I'm glad, and that was why we brought our keynote speaker to come and speak to see, and I'm sure you guys saw how powerful she is. So we need people like that. So we need Nigerian nurses to step up, to be at the policy level. We must diversify our healthcare workforce, but we cannot diversify it if you are not getting involved, if you don't get out of your comfort zone to be involved. Very, very important. If you cannot do great things, do small things in a great way. And that is what we are calling NANNA to do. You cannot conquer what you cannot confront. Where there is resistance, make it a learning opportunity. And that's what we're saying here right now at this conference, that now for the past 10 years, we focus on education, education, education. Now, 2020 to 2030, we are now focusing on leadership, policy, and politics. Individually, we are one drop, but together, we are an ocean. And I know we can do this. So that by 2020, when we come back, we will be able to say in conclusion that we cannot be proud of a world where the so-called knowledge of information society exists along poverty, malnutrition, lack of culture, and ignorance. So as Nigerian nurses, there's a call for you now to step up, even according to Dr. Sheila, who was the Minister of Health for Botswana 2004 to 2008, that we must step up as nurses to focus the social determinants of health that is in front of us. We must help our people to overcome poor health outcomes. And I'm sure that after this conference, you will step up to the plate. And I'm going to hand over to, oh my God, our powerful Dr. McDaniels, who will also focus on call to action. She is so powerful, and I know she has a lot to provide for us.